I don't know if there's a hard or fast number now, but there are several different levels of training courses. There are professional conferences for physicians and for nurses and for um, people, at that level. But there are also several conferences for basically the layperson to go and learn wilderness first aid. And if someone is an EMT or a physician or a paramedic and wants to um, get a little bit more in depth, they could do like an advanced wilderness life support conference. But so there are many different layers of training depending on what's your baseline. I help teach skills, so a provider, whether that be a physician or a paramedic or a nurse, will have the skills to go into the field to provide healthcare in a place where there may not be an available hospital with any time or available resources like a CAT scan or x-ray. So it's providing education and the skills to go to a place and practice medicine in the way that we once did, with maybe just good history, a good physical, with the use of the stethoscope, and knowing that you're going to have to stabilize someone or render health care outside of the manner in which we do now, which is really technology laden. I'm a fellow in the Academy of Wilderness Medicine, and that is sponsored by the Wilderness Medical Society. So that's the best way to describe it is a scholarship academy. So it involves 100 hours of coursework in lectures, but then there is also experiential needs. So actually being out in the field, training, and you get certain other credits for board certification and what your specialty background is, and your research background if you've been publishing and things like that. But primarily, it's your coursework. I've done a lot of training in New York State, where I practice, so particularly up in the Adirondacks, with multi-day canoeing trips on the Saranac Lakes, hiking in the Adirondacks. I've also been to Utah and to Arizona. Utah was interesting. That was another training trip, but it was a lot of hiking in Utah and camping in Utah primarily.
In mountains?
In the mountains and in high plains desert environment. Mountain environments are very interesting in that you might be very, very hot during the day, so you always run the risk of sunburn, dehydration, injury to your eyes from exposure to sunlight. But at nighttime, the temperature really drops. So you might go to a daytime temperature in the 80s to 90s to a nighttime temperature below freezing, because in a desert, there's just nothing to really keep the heat in. So you run the risk of then hypothermia, of being cold and your body temperature dropping unless you have some adequate shelter with you or you can construct adequate shelter. A lot of that study was based on training for things that we don't think about on the East Coast. How to deal with a scorpion bite. The scorpion bite is a venom-based bite. It's often we deal with the same way that we deal with a lot of other bites from insects, but the way we deal with the scorpion bite is primarily symptomatic treatment. Most scorpion bites are not deadly, but can obviously cause other problems like muscle spasms and pain and vomiting. So we try to kind of temper those symptoms until the scorpion venom is out of the system. Wilderness medicine practitioners are a really, really varied lot of people. So wilderness medicine started as on a basis of high altitude medicine, a lot of people mountaineering, but that really touches so many different specialties, ranging from tactical or military medicine to humanitarian response. So for instance, when the earthquake in Haiti occurred several years ago, there were several well-known wilderness medicine practitioners who went down to help in the environment because the skill set fit. It was a low resource environment, and you had to be able to support yourself and take care of patients. You will see people who want to go overseas to maybe a fixed healthcare clinic in a low-resourced area, in Africa per se. I would say absolutely yes, because I think I've been involved with medical education basically since I was out of training. And I think one thing that I've seen in medical education is, sure, in medical school we learn how to do a history and a physical, but what's next is, what do our lab tests show? What do our x-rays show? What do our CAT scan shows to get a patient picture? What the emphasis on wilderness medicine provides is that it's just basically you and the patient. You have to take a good history, you have to take a good physical, you have to really focus on your communication skills and your interaction with you and just one other person, and that's gonna enrich you as a physician, no matter what specialty or what field you work in. But I also always go back to, you never know when you're gonna be needed. You never know when you're on vacation and you're gonna be needed and you're in a limited resource environment. You never know when you're on a plane and a physician is asked for. I've heard the call overhead and I've done the stand-up, but then it's been it's been canceled. But I have friends who've been on international flights who've taken care of very, very ill people on planes. And so just having this training gives you a certain level of confidence in managing anybody. These skills are not taught in medical school. So I think now, as we are becoming global citizens, as we have more physicians joining organizations, let's say like Doctors Without Borders, and are going to places, they also have to expect that there might be some element of having to take care of themselves. So whether I'm in the military, whether I'm going to go on a mission, a medical mission somewhere, if I'm going to do humanitarian response, you always want to make yourself an asset and not a burden. And in a lot of these low-resourced areas, if you go in without the knowledge of knowing how to sustain yourself, you become a burden. So a lot of well-meaning physicians and nurses and paramedics have gone down to areas of need, Haiti after earthquakes or other places, but without having the knowledge base of how to sustain themselves in a place that has no infrastructure anymore, they quickly become burdens on the local environment. If you go down and you don't know how to sterilize water, and if you don't know how to set up simple sanitation for yourself, or maybe how to make a shelter, or if you don't bring food for yourself, you become a burden to a location that's already burdened with low resources, despite all your good intentions to go down and provide health care.